EVV team, and I'm joined today by a couple of my coworkers, Sarah Wozniak and Missy Loveday, and they'll be helping throughout the presentation and answering questions. This session is being recorded. We want to make you guys aware of that so that you do not share personal information in the chat. The chats are public to everyone. We want to be able to post this presentation in the next couple weeks so that others that weren't able to join today are able to review it. Please hold your feedback or your comments until the end. You'll enter it via the chat box and we'll answer it in the chat, and some we will be answering live. Microphones will remain muted throughout this presentation. So we have a brief updates for you guys today that we want to go through with you. The current status of EVV. So all providers, regardless of the payer for personal care, must have completed the provider enrollment survey. It is linked in this presentation. You can also find it on our webpage or the HHA Exchange webpage. And that providers must begin using their chosen EVV system. So this includes training your caregivers and members, uploading information, verifying your EVV visits, and also sending data to DHS if you're using a third-party system. MCO providers, we launched our MCOs on June 5th of 2023. The MCO providers, they should have received a welcome letter from their MCO that will provide them with the next steps that they need to take to onboard into their EVV system. There were also info sessions held within the last couple of months for these MCO providers to attend, which gave them more information on their next steps for onboarding. And if providers that work with an MCO have any questions about EVV, they should contact their MCO, and also any concerns they may have around EVV, please contact your MCO.
All right, so through our first three phases of implementation for EVV, we have launched into a soft launch, which essentially is a time period where DHS is not enforcing any sort of compliance benchmarks or things like that that are going to result in any kind of claims denials or claim reversals. And we announced that will continue throughout the year 2023. One of the reasons for this is just to give, EVV is a big change, just to give people some time to onboard into their systems, get, your administrative staff trained, get folks receiving services trained, caregivers, everybody trained and adjusted to using the system before compliance benchmarks and enforcement begins. We are currently monitoring compliance, since we do see the data coming through. It is flowing successfully, so we are aware of providers are seeing some trending upwards and some onboarding and some rolling implementations across the board from provider agencies. So we really appreciate all of the folks who are ramping up their EVV usage. And then we do expect to provide an update on compliance before home health launches later in 2023. And again, we will make sure that we provide ample time for notifying everyone for when compliance enforcement begins. This is just your first warning that in compliance enforcement, there will be eventually compliance enforcement for EVV. You can go to the next slide, Amanda.
It wasn't moving, thank you. So we do have a brief home health update. Home health is still planned to launch by the end of the year, 2023. Providers should start looking in their minutes mailbox and through eList and other communication channels for a welcome letter that will be sent out later this summer. In this welcome letter, it will provide the next steps for onboarding, and it'll also have the link to complete the home health provider enrollment survey. And this survey is different than the one that is currently posted on our EVV webpage and the HHAX webpage. The one that's posted currently is for personal care services. So if you provide personal care services, please make sure you fill that out. Home health providers, please be on the lookout for that new link to the home health survey later this summer. There'll be information sessions that will be provided to give providers an overview of the HHX system and also about connecting third-party systems if that's what your provider agency chooses to do. In order to start the onboarding process, home health providers must complete the enrollment survey. This also goes for all other providers. In order for you to be able to receive your portal credentials, you'll receive portal credentials regardless if you use the HHAX system or if you have a third-party system. This is also how you receive your training credentials and then your welcome packets that will provide you with your schedule for onboarding and then all the training dates for you to attend and links to your trainings. And this is, again, this also goes for personal care. So if you haven't done your personal care enrollment survey, do it, and then you will also receive all this information to follow.
All right, just a couple of really quick updates on some policy things. I know a lot of folks are anxious to hear some updates, and we've been working hard at taking information. We began implementing EVV back in June of 2022, so we've had some sort of EVV phase live with EVV for about a year now. And so we've taken a lot of lessons learned, information from providers, and feedback from caregivers, provider agencies, folks using, people receiving services, people using the systems. As we're making these policy decisions to help inform both our policies and our best practices. We are very close to publishing quite a few policies, specifically about living caregivers, safe at home, and device usage and EVV methods. That piece does include the next steps for IVR within the state system, which is the telephony where folks can call in to clock in and clock out. And then also, like I mentioned earlier, compliance update. We do expect to provide those updates later this summer, and again, especially before the implementation of home health.
Our latest update to the services for EVV required under EVV was the removal of PCA supervision. We, through many lessons learned, like we have used for a lot of our guidance with EVV, we received valuable insight and feedback that helped us take a look at our services and help redefine what our approach is to EVV. So with that, DHS made the decision to no longer require providers of PCA supervision, P1019UA, to use EVV. So with removing this, this will also help providers streamline EVV, and it'll help reduce the confusion around required services.
Okay, just a couple of quick reminders for folks outside of like policy questions about, when will we have a compliance plan, and, about questions about the specific policy things that we just talked about previously. These are probably the two most common questions we're seeing right now from provider agencies. The first one I want to give everyone a reminder on is about documentation requirements, and a reminder that EVV doesn't replace any sort of documentation. It's everything's in addition to. And so whatever EVV system you have chosen to use may not meet all of the documentation requirements for the services that you are enrolled to provide. So as a provider agency, it is your responsibility to make sure that you are reviewing your documentation requirements and that you are staying informed on current statute and licensing requirements, and that you are meeting those documentation requirements in addition to EVV. That may be meeting it through your EVV system for some folks, and that may need to be outside of your EVV system for others. The second is probably the number one troubleshooting question we see with everyone using HHA Exchange and third-party systems is, you're missing people in your portals. And the biggest reason that we're seeing that is that all of your enrollments, your NPIs, your UMP numbers are not provided to HHA Exchange when completing that provider enrollment survey. So every provider agency, regardless of whether you're using a third-party EVV system of your choosing or you're using that HHA Exchange system, you're going to receive a provider portal. And within that portal, you have what HHA calls an office. That's essentially where you see your different enrollments for different types of services. So most common, it's like if you have a different enrollment or different NPI number for your PCA and your homemaking services, you'd have two offices that you would see in your provider portal. And so if you find that you're missing a chunk of people or a specific, everyone who's receiving a specific service, the first thing that we're all going to check is, that the right NPIs are associated with your provider agency and the right offices are set up. So Just a reminder, make sure that's your first troubleshooting step. Contact HHA Exchange, say, hey, maybe missing an office. I'm seeing, a chunk of people missing, or all of my homemaking services are missing. Here's the MPR, the MP that we use for that service. Can we get an office created? Yeah, and those are the couple reminders that I have on those.
I just want to add to that, Sarah, that we did update our Contact Us tab on the EVV, the DHS EVV webpage that breaks down the different places to contact for certain questions, just to follow up on that contacting, which will hopefully be useful for people to get to the right place when asking questions.
Perfect. Thanks for that addition, Amanda. And that's really all we have today. Just really short and sweet updates on EVV. Please feel free to put any questions that you have into the Q&A panel. There's a couple that we have already received. We'll take a second to just review those and assign those out to our team who's responding. But do please remember, Amanda said it earlier, that this chat and this presentation is being recorded, so do not put any kind of confidential information even in the Q&A panel. And then we will be answering those for everyone to see. All right, it looks like Amanda put in the chat the link to our DHS website for EVV, and that's gonna, if you click on the Contact Us tab on that link, that's what the contact guide that she was just referring to. It sort of lays out various topics that you might have questions on and where to direct those questions for the most efficient answers. And I can just jump right in with some of the Q&A. I'll start towards the top here while the rest of the team gather some of those questions. One of the first questions that we have is we're having problems getting connected to the HHA to set up the EDI tool in the portal. So unfortunately, please make sure that you're following the directions on the HHA Exchange website. There's a specific sub page for EDI connections and a set of directions that involves creating a ticket. If you've gone through those steps and you're still having trouble, you can complete the contact form and be sure to include your HHA Exchange ticket numbers or connecting to the EDI system, and we can look into those tickets. But if you haven't contacted HHA and you don't have HHA ticket numbers yet, that's going to be your first step. Another question is, will compliance announcement provide a 90-day notice? So I'm not going to speak to or guarantee any kind of timeline. It'll be enough notice for provider agencies, but please do remember, you are supposed to be using EVV right now. So we are in a soft launch. We do expect that provider agencies are getting used to EVV. So there will be enough notice. It won't be a surprise, effective immediately sort of situation. But you should be using EVV right now, and there will be a heads up, but I can't speak on any kind of timeline at this time.
I did put the personal care services enrollment survey in the chat. It can also be found on our website under the provider tab that lays out the steps that providers will need to take. And as like I said, the home health provider enrollment survey has not gone live yet, and we will notify providers when that has gone live. This training recording and the slides will be posted on Train Link, I believe, and we will also work on updating our webpage to link them out, link you to them as well, and including our last meeting that we hosted at the end of last quarter. For home health and the services, you can find a list of our required services on our DHS EVV webpage. Also, if you go under the provider webpage, I can actually, let's see. Sarah, can you guys see my screen?
Yeah,
with
we can
the
still
web
see
page?
it. Yep.
Okay, so we do have a provider tab that lays out the provider requirements, where we're at with compliance, and the steps that you need to take. On this tab as well is a detailed list of our required services and a breakdown of when they go, if they've launched or if they have not launched yet. So you can find all your codes for billing and the services required under EVV on our provider tab, along with the personal care enrollment survey link. And this is our contact us tab now that you can see. It's laid out of who to contact with your questions and what team will be providing you with that assistance. That back.
All right. I got a couple more Q&As here from the chat. Music therapy, providing ILS therapy services. Again, the list of services that are in scope, it's based on that procedure code or the HCPCS code that's billed. So please make sure that you're referencing the specific service that you're providing and how you're getting paid for it, how you're billing for it, to see if it's in scope or not. Another question we have is about documentation. In paper timesheets, a signature is required. You say that EVV is additive and doesn't replace any documentation, presuming that excludes signatures. So it's kind of a complicated question. So for PCA, the signature, I'm assuming we're talking about signature, we're talking about paper time cards here. That signature is still required. So there is a way that it can be done in the EVV system through HHA Exchange. At this point, it's probably in your best interest to continue doing paper. We're still working out how to identify some of the various components of that PCA time and activity sheet, such as you'll notice that there's no place to note when someone's out of the community, which is a requirement for PCA documentation. So again, complicated answer, yes, there will be a way to get a signature within the HHA Exchange system. Cannot speak for a third-party system. You'll have to work with your own vendor on that. But so the EVV system may be able to replicate that in the future. But again, it is up to each provider agency to make sure that they are compliant and following all of the statutory requirements for the services that they provide. One more question I'm seeing about soft launch. I'm sorry, I'm trying to read ahead and combine some of these so I'm not being so repetitive. So excuse me if they are a little bit repetitive, but it's asking about if there's going to be billing incorporated in the soft launch. And I just, again, another reminder that billing at this point is not in scope for EVV. So you are not required and should not be using your EVV system for billing. Nothing's changing. You'll continue to submit claims in the way that you've been doing it and are currently doing it. So using EVV really just means, yeah, clocking in, clocking out, meeting all of those 6 data points for the EVV compliance, which is person receiving services, person delivering services, the location, the service received, and then the time in and time out.
For the issue with the EDI and connecting third party, if you could reach out to our team using the DSD contact form, I did link that in the chat, so you guys could have a direct link to that. Please email us and make sure to include the ticket numbers or any ticket numbers that you've been issued by HHAX because that helps us get to finding the answer sooner. So reach out to us and we will work to figure out what's going on there.
All right, I'm gonna try to lump again together a couple about services in scope. I'm sorry, I missed the one about day services when I was talking about services in scope. So right now, yep, day support employment is not in scope for EVV. Again, not to sound like a broken record, but please make sure you're always checking our website that it does contain the most up-to-date list of services in scope for EVV. And right now, yeah, EVV does not include residential services or any kind of vocational service. It's a good umbrella way to remember that. I'm going to keep going here. And I see a question about if DHS is okay with using implementing EVV through a fob device when using a third-party vendor. Yes, absolutely. When you're using a third-party vendor, please feel free to use whatever method of verifying EVV works best for your agencies and folks that you support. You can absolutely use a fob with a third-party vendor.
I also want to note in terms of services that if the services are not required under EVV, then they will not be used within the free state system. And HHAX won't load those services into the system. I don't know if Sarah, if you want to expand on that anymore.
Sure. Yeah, I can't expand a whole lot more other than, yeah, right now the EVV system, HHA Exchange, is only configured to accept the services that we tell it to accept. So it's not going to we have an import process that imports files from the MOIS system, and it's not going to pull over any sort of out of scope services. It's only going to update for services in scope. Which is again listed on our website. And I kind of want to segue into another question that I saw asked in the Q&A about staff not showing up in portals. Again, this is more of a specific troubleshooting thing, but broadly speaking, the staff import is something that you have to do at your provider agency level. So that's depending upon your EVV system. That might be a provider agency manually entering anything, using a mass import process through HHA Exchange or whatever your EVV vendor uses. If you've done those processes and you're still not seeing folks associated with your individual's profiles as their caregivers, then you're going to want to contact HHA, get a ticket number, and try to troubleshoot that with them, because that does sound like a technical issue. And then I'm trying to group again, I see a couple questions about location. Does PCA homemaking, ILCS, IHS, all the services need location on? So location is required. Location capturing is required for all in-scope services. That is one of the federal requirements of the Cures Act, which is what mandates EVV. So that location capturing has to happen at the beginning and the end of the shift. There is no location tracking that can happen or should happen during the shift. It needs to capture where the caregiver signed in, clocked in for their shift, and where the location that the caregiver clocked out from that shift. Again, that's required for all of the in-scope services. I see a really interesting question about, is there any chance that IHS with and without training will be taken out of EVV since the main service is not necessarily related to personal cares, although some may occur? I think that's a really great question. Unfortunately, I can't give you a solid answer on that. I think the state of EVV could be potentially fluid, in that we do have the ability to expand or restrict or change services as they fit within the federally defined requirements for EVV and the Cures Act. the determination of services that were in scope is really based upon, you know, how the service is authorized, how it's assessed, and then, you know, greater percent, you know, the time spent providing care. Kind of an overall analysis was used by some folks here at DHS to determine, you know, the services that are in scope, and those were determined to be in scope services. So for right now, they remain in scope, and at this point, there is no intention of removing any other services from being requiring EVV. I see a couple questions on safe at home, and I'm sorry that y'all just keep hearing my voice and not really giving anyone an opportunity to jump in, but I really want to make sure that we touch on this. So I'm seeing it pop up a couple times. One thing right now, I know we said that we'd be giving an update a couple slides ago on safe at home later this summer, but right now you should not be using EVV for folks that are in the safe at home program. We do have that was in one of our updates that we did a few months back. But we are not, you should not be collecting any kind of location information or anything like that, or doing any sort of EVV for those folks associated and enrolled in the Safe at Home program. And that might be people receiving services, and that might also be caregivers, people delivering services. So in either respect, there should not be any EVV participation by those folks in Safe at Home right now. Like I said, we will make an update or provide an update later this summer with you know, additional information and some next steps on where that is going, but right now do not do EVV for safe at
home. There's a question about the MCO, missing couple MCO clients and being sent to HHAX. I would say if you're continuing to have issues, reach out to us with your ticket number, and we'll make sure to connect you with the right people to help resolve that. It's real. I just want to stress it's really important that when you reach out to us, if you haven't opened tickets or even closed tickets with HHAX, as the one example said that it was closed, please make sure that you include those tickets when contacting us, because it helps us streamline getting answers back to you sooner rather than later. So for MCO stuff, you are supposed to contact your MCO, but if you're still running into issues and barriers, reach out to us and we'll connect you with the right people.
All right, I see a couple of questions about IVR telephony. The first one was that HHA has said that someone is not able to use IVR when using a third party. So that is not correct. If you're using a third party system, you know, have at it, use whatever, like I mentioned earlier, use the EVV methods that work best for you. We have not yet, for people using HHA Exchange, DHS has not made telephony or IVR available yet. So it's possible that HHA is getting confused. Again, please, if you have a ticket number and if you haven't already contacted HHA, make sure you do that. And if you have contacted them, excuse me, you can use the contact form, the DSD contact form, to send us your ticket number and some additional contextual information, like what EVV system you're using and things like that, so that we can help facilitate or look into that ticket. It may just be a clarifying thing. We're happy to help facilitate that, but as long as you have a ticket first. And there's another one that says, is telephony an acceptable option, and does it have to be a landline? So yes, telephony is acceptable. If you're using a third-party system and already have the ability, like I said, to do that, go forth and do telephony. The state system, it's not yet available. It will be available in the future. It's just not available right now. We are using a mobile-first approach, and using that mobile app is really the fastest, easiest, and most comprehensive way to complete EVV, you know, for everybody involved. And, you know, does it need to be a landline? Again, I can't 100% speak to this. I don't know what EVV system you're referring to. I don't know if you're using a third party or an HHA Exchange system. So if you have a specific question on that, first start with your EVV vendor to see what requirements their system uses as far as telephony and IVR go. but it does still need to meet the requirements of the Cures Act. So you have to be able to confirm location in some way. And that typically is most often done with a landline. But there are ways to do it without. And again, you need to contact your EVV vendor for details on that.
Sarah, I just want to follow up with the IVR question for third party. So third party should be working with their third party vendor for device options. HHAX does not provide devices to third parties. And so you need to work with your third party vendor for the devices available to you. I don't know, Sarah, that's all really with that, right? So just if you're using a state selected system, you'll be when devices for IVR, the IVR lines will, once DHS figures out is available, but it's not with a third party, you need to use your third party system for IVR and devices.
Yeah, great. Good clarification there, Amanda. Going through, I've seen a question that says, I'm working with clients, with folks on CDCS and was told that that waiver doesn't require EVV, and asking if that's true. So broadly speaking, no. So the component of CDCS that requires EVV is the personal care. So the direct staffing is the part of CDCS that requires EVV. Things like home mods, equipment purchases, goods, that sort of thing, doesn't require EVV. Most people tend to use CDCS for the personal support option where they're getting that one-to-one staffing. And so that would require EVV. Okay, again, another question I'm seeing is for manual shifts done after the fact, do you still require location capture? You're using third party. So yes, you have to complete all of the data requirements for any kind of shift that you're doing. You still need to note, again, I don't know how your third party system is working, but all shifts should have, you know, all of the required Cures Act data in them. A managed service is still not going to be EVV compliant, so either way, you know, it's not compliant, but you need to have all of that information included in the visit. And then, yeah, the case manager question, will there be guidance given to case managers? Because service agreements are not always sent timely. Yes, we are working on that right now. We know that can happen. We're trying to work internally on, you know, some policy around what happens when you don't have a service agreement yet because of a delay of, you know, out of your control, and then getting additional information to case managers on, you know, why it's so important that they be timely with that. We know that there's a delay at a lot of the county levels, and that's really outside of a lot of folks' control. So, but again, we're just trying to get some input of them about being timely and the, you know, getting what they can authorize when they're able to. All right, I'm gonna backtrack a little bit on the questions in the Q&A. There's a question about reading reports. I'm not sure if that one is specifically about reading reports within the HHA exchange system or with your third-party vendor. But in any case, that is really a system question on how to utilize the system. So that requires, you would want to contact HHA exchange or your EVV vendor for information on how to access reporting, reading it, interpreting it, that sort of thing. All right, folks, be patient with us. We're still just kind of consolidating the last couple questions here.
There was a question about the enrollment process for MCO providers, that they need to start enrolling July 17th, that you're set up with your MCO with HHA Exchange already. So you should be following the process that your MCO has laid out for you. The other providers that are providing personal care services should follow the process that I showed on our provider or our EVV webpage using that survey. So what your MCO has laid out for you to do, follow that process for personal care services. As far as GPS, it has, you can capture it as in-home or in the community. And your shift could start, let's say you pick somebody up from their work and that's where your shift starts. That's where your shift begins. GPS does not continue to track throughout your shift. It's only captured at the time of clock in and clock out. So you would be capturing where your start of your shift is. Now you can go, and that doesn't mean that you can't continue on throughout the community and perform the duties and services that you're providing. And then when you are done with your shift, let's say you end back at home, then you would clock out there, and that's where your GPS would then capture location.
All right, I see another question about MCOs, mainly saying enroll, but that's all from them, same letter. Again, you need to contact your individual MCO with any questions that you might have. MCOs are live and should be in that soft launch period using the EVV and getting folks adjusted and onboarded. And so specific questions, whether or not you're working with one or many MCOs, you'll have to contact each one of those individually because they're all a little bit different. And I know that is a little bit of an extra step, but that is sort of the process and the workflow with that right now. I'm seeing a question about how accurate is the map pinging. I'm assuming we're talking about GPS. Again, I don't know what system you're talking about. And it's going to vary based on the EVV system and the app. But it should be within the HHA system. It should be fairly accurate. It's definitely possible in areas where there, may not be service or things like that. It could be a little bit off or a little bit of interference, but it shouldn't be, saying that you're in a different state or anything like that. So it should be fairly accurate. I'm seeing a lot of questions about manual shifts and locations and things like that. I can't speak broadly for everyone's EVV system. I know some of you are using HHA Exchange, and I know some of you who are asking questions are not using HHA Exchange. So again, how you enter a manual shift is really a technical question. Please reach out to HHA Exchange, get a ticket number to get some direction on how to enter those shifts. But as a reminder, really should not be, completely, mistakes are going to happen. People are going to forget to log in, log out, errors may happen in systems. But as a general rule, we do want to limit the amount of manual shifts that are happening. And it is possible when you're using a third-party system, if you're not meeting all of the right requirements of the data that HHA is expecting, that your visits will get rejected. So it's really important that especially for those third-party users, you contact and connect with HHA Exchange about exactly how you need to submit that data to avoid those rejections. And really same goes for folks using HHA Exchange. You're going to get errors if you're not following the technical specs and the way that the process is outlined within the system. And HHA Exchange will be able to direct you on those questions.
I did put in the chat the HHA Act Minnesota Provider Information Center webpage link. There also is a tab on there for Minnesota MCOs to walk you through more of the MCO implementation.
All right, I think we're getting towards the end of the questions that I'm seeing here in the Q&A. So I'm gonna give everyone just a couple more minutes to pop those last minute questions that you might have in there while we cover the last couple here. One of the questions I'm seeing is the acceptable GPS, excuse me, discrepancy range. So right now, the EVV system is configured to accept a geofence of 500 miles. However, when we met with CMS for our kind of pre-go live certification, they had some questions and some concerns about that range being so large. So that is one of the considerations we have to talk about internally and sort of some next steps. But at this time, it is configured to be 500 miles.
Well, it looks like we are coming to an end here. We appreciate all of you joining us today. If you have further questions, please contact us through the DFT contact form, and please visit our webpage to find out more information. Like I said, home health providers can anticipate receiving their welcome letters that will provide them with next steps and when information sessions will be held later this summer as we move towards our phase 4 launch by the end of this year. So again, thank you all so much today for participating and listening to our updates. We do have 2 more sessions coming up. The next one will be September, at the end of September. And then the other one will be mid-December before all of before we move into the new year. So we look forward to seeing you all again. And again, thank you. I hope you all have a wonderful day.